Hi, good morning or good afternoon. My name is Claire Villione and I'm the UC San Diego ACTRI Dissemination and Implementation Science Center Manager. Today in this short informational video, I will be walking through the application procedures and requirements for the 2022 ACTRI DISC D&I pilot grants. And Jamie Palapel, who will also be coming on to talk through some FAQs. Some frequently asked questions about the pilot grants. So to start, the aims of our ACTRI DISC pilot funding are as follows. First, to support research that reflects priorities of local stakeholders and governmental agencies, including projects that address risk factors and/or diseases and conditions identified as priorities in our most recent County of San Diego Community Health Assessment. Risk factors might include behavioral health conditions, resulting diseases or conditions, may include kind of cardiovascular disease, stroke, accidents, things like that. Number two, to stimulate D&I research focused on health disparities in San Diego and Imperial County, to encourage local clinicians, community practitioners, health administrators, and health science scholars, those perhaps outside of a typical academic context, to integrate D&I science as an important part of their careers. We hope to generate new publications on D&I research in peer-reviewed health journals, generate data that will lead to funding from the Agency for Healthcare Research Quality, the National Institutes of Health, PCORI or Patient-Centered Outcomes Research Institute, or other funders that typically support D&I research. Lastly, we'd like to advance the science of D&I through the application, development, adaptation, or refinement of existing or novel D&I methods, models, or measures. A few example questions that would be responsive to the DISC pilot funding. First, how to adapt public health interventions, existing evidence-based interventions to the needs, resources, and context of a specific community, or perhaps a faith-based organization, or low-resource community clinic. You could also explore cost effectiveness or cost benefit of one implementation strategy over another. Third, what are implementation strategies that can be used to increase the uptake of evidence-based screening recommendations across diverse federally qualified health centers? In the last example here, how can we use authentic and meaningful stakeholder engagement to develop and refine implementation strategies so they can be feasible and acceptable across different community health clinics? More concretely, here is a proposal example. So the context here for this proposal, within any one community-based group, there have been significant differences in the extent to which a certain evidence-based practice has been successfully applied to different patient populations, such as different cultural groups. We've noticed that males are responsive to this intervention, but females not, old versus young, affluent versus poor. So looking across different subgroups and noticing uptake, sort of differential uptake. So the D&I research questions could be, are there implementation strategies that could be adapted or tailored such that healthcare providers can reach certain subtypes or patient subgroups? If so, what are these factors that might also be associated with the successful reach, implementation, and sustainability for this evidence-based practice for this patient subgroup? And how do the proposed implementation strategies fit with or advance implementation science theories or frameworks? So those are all examples of D&I research questions within that context that could be responsive to this proposal. Another example here, the context would be evidence-based interventions for physical activity exist, but they're not readily implemented, particularly in low resource community settings. A few D&I questions that could be applicable here. What are some implementation strategies to adapt to these interventions, to the needs, resources, and context of specific community contexts, such as faith-based organizations or community resource settings? What are the strategies and processes we can use to work with community leadership and members to make these adaptations culturally and contextually meaningful? lastly, how do the proposed strategies fit with or advance, again, implementation science theories or frameworks? For the review for these awards, we proposed 3 different unique rating systems. And this is the second time that we've kind of compiled these different rating systems together to come up with an application score. So first, we're using the NIH scoring criteria, which 1 is the highest impact and 9 is the lowest impact across the 5 typical domains of the NIH scoring criteria: approach, innovation, etc. Projects will also be evaluated with INSPECT, which stands for the Implementation and Improvement Science Proposal Evaluation Criteria. And this is a tool that's been developed specifically for D&I proposals. And based on our use last year, it fit well with the DISC pilot awards, and it's more tailored for implementation science methods and measures, which NIH scoring criteria cannot always align with. And this INSPECT criteria was based on the key ingredients for successful implementation science proposals paper by Proctor et al. And it was further developed and validated by Erica Crable and other colleagues. The last set of criteria used for this application are the community-based review, which includes 3 central questions, which I will explain in a moment here, centered around community engagement, strength of your community partnerships, and short and long-term population outcomes. So if it wasn't already clear, sort of community driven work is a component of the application. So the D&I review criteria INSPECT includes 10 domains listed here, rated on a scale of 0 to 3, 3 being most comprehensively included and applied, 0 meaning not well applied. And the listed criteria are also in an appendix in the full RFA, so you can access this list as well. An example domain is number 3 in that list, which is inclusion of a conceptual model and a theoretical justification. A score of 0 on INSPECT here for this specific criterion would be that there's no conceptual model, framework, or other theoretical grounding discussed at all, or it's some aspect of the model cited, but really it's not relevant to the study, and it's not applied at all to the process of the proposal or the research plan. 3, on the other hand, which is the highest score for INSPECT, would be that you have used an implementation or improvement science specific conceptual model or framework, and it's clearly described with theoretical constructs explicitly laid out within the proposed setting, population, and the various intervention contexts. So you're really well applying the framework throughout all aspects of the study questions, the aims, hypotheses, process, and outcome measures. 3 may also include some discussion around how findings would build upon or otherwise contribute to theory or the larger implementation science field, or the application of this model kind of as a novel application of the model, but that's not required for a 3 here. Measurement and analysis is another example INSPECT domain, and a 0 here would be that you have outcomes, but they're not implementation or improvement science related. So perhaps you only have sort of traditional clinical effectiveness outcomes. That would constitute a 0 here. Outcomes are not well linked to your proposed aims. The unit of analysis is inappropriate. Versus a 3, outcomes are implementation or improvement science related. They're linked to your proposed study aims, and the unit of analysis is appropriate for the proposed study. The community-based review, as I said, is centered around 3 key aspects: the strength of your community engagement, the impact on community, and the impact on human health. And this has been slightly expanded from last year. So the strength of the community engagement first constitutes 33% of your score. And this will be completed by a community reviewer, not an academic reviewer. And they will look to see how well is your community engagement approach laid out. Do community partners share in the design and conduct of the project? Who is a part of the project oversight? Would that include community partners or not? Will both partners benefit from the work and from future research treatments or interventions based on the work? What about funding and sort of how equitable is the funding amongst those that are included in the research? And does the community partner represent in a meaningful way the population under study or the target population? Secondly, potential impact on the community. The community reviewer who is evaluating this will look at the potential for the research to have a significant positive impact on the individuals who are the participants in the community. That is the focus of the proposed research. So based on your target population, what impact are you making on those people? Consider also here the potential immediate short and long-term impacts of the work, and how will the researcher be communicating any relevant information back to the community, looking across various potential outcomes and impacts of the work. What are we feeding back and circling back to the community? And lastly, the kind of overarching question, the impact on human health. How important is funding this research to improving health in the near or more distant future? And these are equally weighted, 33% across these three domains. So the rating system process we include 3 masked reviewers, 2 faculty academic reviewers pulled from our DISC investigator list, and 1 community reviewer. And this, we are partnering with ACTRI and their community academic pilots, and they also use community reviewers in their application and review process. And so they've been community reviewers tend to have participated before. The 3 scores will be weighted as follows. Inspect will be weighted in the score slightly more so than NIH and the community. Inspect is most fitting for our D&I style proposals. So 40%, and then NIH 30%, and community rating is 30%. The deadline for 2022 applications is December 1st, 2021 at noon Pacific. We will notify you of your award and schedule a consultation meeting in early February. So the turnaround time is fairly fast, a couple of months. Final funding is contingent on a successful completion of the IRB, and final approval and notice of award would be in late February. The funding period begins May 1st and extends to the following year, so April, and then extends to April 30th of 2023. So now I'll talk through the application steps for the pilot award. First, the application is through Qualtrics. It's a link in the RFA, and it's a very short form. So make sure before you start to submit that you've reviewed the corresponding PDF RFA in detail before doing the application in Qualtrics, because there's just not as much detail and guidance. Questions about the application platform, about Qualtrics, any technical difficulties here, please direct those to disc@health.ucsd.edu. The bulk of the application is this 5-page application combined into a single PDF. That's a specific aims page, background and significance, preliminary studies or data collection and analysis would be a single page, research design methods, approximately 2 pages, and a reference, and you can include references which are not included in the 5-page limit, and that's combined again into one PDF for upload onto Qualtrics. More detail about these specific components of this application are in the RFA. If this is not already clear, we want to make it extremely crystal clear that we need you to incorporate a D&I theory, model, or framework to be used throughout your project to guide the research questions design, measure selection, analysis, interpretation, and reporting of the research findings. So really take advantage of the D&I theory, model, or framework and explicitly thread it throughout your proposal to guide your plan, your measures, the interpretation of your measures, and the reporting of your research results. If it's appropriate, we always encourage considering how the project will advance the D&I science and the application or use of theory, framework, or models, but that aspect is not required for successful review. Please upload your page on community relevance to Qualtrics as well. And this is a single page statement articulating the community relevance of your proposal based on the criteria that I just walked through that the community reviewer will pay attention to. This should be written in an 8th grade reading level for the non-scientist reviewer. Do not include your name, as this page will get a mass review. Statement should answer the following questions. How are you engaging and partnering with the community? How will both partners benefit from the work and from future research, treatments, or interventions? You should be able to describe how the community partner represents the population under study, consider and walk through potential immediate short-term and long-term impacts and how the research impacts the community of focus, thinking more long-term. And then you should be kind of explicitly lay out your process for sharing back relevant research results, plans, next steps, health resources with the community after your pilot concludes. And then the last question, how important is funding this research to improving human health overall? The next step of the application is a 1-page dissemination plan. And this is a description that outlines your plans for disseminating your results of your research. So any plans for follow-up grants or proposals, academic products such as publications and presentations and conference participation, other types of products, toolkits, playbooks, advocacy documents, decision aids, community-facing products. This should also include information about how you will share back relevant results or relevant research information with the community of focus as well, similar to the previous page. And the nature of each of these products outlined and the target audience, whether it be researchers or policymakers, clinicians, community partners, community members. Please specify the nature, the target audience, and again, the kind of the process for development of this product and how it will be shared. You can also explain here how you will use the services provided by the UC San Diego ACTRI DISC to support your product development. This might include journal clubs or meetings or other resources we have online. How will that support the development of your product? The NIH Biosketch is included for everybody in the, that's a principal investigator, co-investigator, or any of trainees that are on the project. Biosketches will need to be combined into a single PDF for upload. A link to the most recent NIH Biosketch template is in the RFA. We ask that you provide a detailed budget, which this equates to the NIH budget form page 4, and there's also a link in the RFA. And we would also ask for a brief budget justification to couple your detailed budget. A few pointers on the pilot funding. Funds must be spent within 1 year of being awarded. There's no carryover. Investigators must have IRB approval in place before the beginning of the funding cycle. We actually ask that you submit an IRB application at the time that you apply for the award. No funding is provided for travel, clerical help, office supplies, or books. This is similar to NIH awards. Indirects are not awarded to UCSD or other investigators, and awarded funds that transfer to subcontracted agencies may be eligible for indirect or overhead costs. But in these circumstances where overhead is needed or indirect is needed for a subcontract, a maximum of 10% will be provided. So requests for overhead must be included in these initial budget requests and very, very clearly described. An IRB application is required for funding, as I just said. So we really encourage you to submit your IRB application at the same time you submit your pilot award. It takes time to get IRB approval, and final funding is contingent on the IRB application. Thank you so much. And just a reminder, please feel free to reach out with any questions about the pilot award application process or the review criteria. Questions should be sent to disc@health.ucsd.edu. And either Jamie Palapal or I will follow up with you. Thanks so much.
Hello, my name is Jamie Palapal and I am the DISC coordinator. As Claire has mentioned, we have anticipated some common questions. That said, we have created a frequently asked questions section for your review. The first question is, do I have to be a DISC member to apply? Yes, to apply for our DISC Pilot Funding Award, you must become a DISC member or investigator. To learn more, please scan this QR code to become a DISC member. As a member, you will gain access to the many benefits that the DISC has to offer, like awards, resources, and events. Do I have to be at UCSD to apply? Faculty, project scientists, research trainees, postdoctoral fellows, and community practitioners at UC San Diego and ACTRI partnered institutions are able to apply. We have listed some partnered institutions below. If you or a PI fall under these institutions, you are eligible to apply. What if my project is in a formative phase rather than an implementation phase? We will review and be open to projects that are in the formative phase. We will review project proposals at any stage of the research process. We also understand that pilot proposals need to have appropriate scope and feasible aims for the 1-year duration. Can I ask for a meeting or consultation about my proposal? In order to be fair to our DISC community, we are not offering one-on-one consultations before the proposal deadline. However, we have some suggestions and D&I resources to help with your grant proposal. We encourage you to network with fellow researchers and colleagues for valuable feedback, and we have also posted a brief introduction to D&I science on our YouTube channel, which you could access through our website and Twitter. If the proposal is funded, we will provide consultation to the awardees. When is the deadline to submit? The deadline for 2022 applications is December 1st, 2021 at 12 p.m. Pacific Standard Time. Do I need to have a D&I scientist on my proposal to be successful? You do not need to have a D&I scientist on your proposal to be successful. Once your proposal is funded, you will obtain support from the DISC consultation team to refine your D&I methods and ensure your proposal is clear and comprehensive. You will also have an opportunity in the application to show how you will take advantage of the DISC trainings, workshops, journal club, and work-in-progress meetings, and other resources to increase your D&I expertise. Can a PI be from a different institution and the co-I be from UCSD ACTRI partner institution? For our pilot funding, the PI needs to be at UCSD and/or one of the ACTRI partner institutions. The non-UCSD investigator can be a co-I for the pilot funding. We have some valuable resources to help familiarize you with dissemination and implementation science. For instance, we have information on D&I basics, trainings, and other valuable resources to help you in your D&I proposal preparation. Scan these QR codes to learn more. At UC San Diego ACTRI DISC, we thank you for showing interest in the DISC Pilot Awards. If you have any questions or comments, please email us at disc@health.ucsd.edu, visit our website, and join our DISC community. Also, follow us on Twitter for more updates on DISC activities, resources, and events.